Welcome to the Wellness at Work podcast, brought to you by the Learning and Development Projects at Silberman School of Social Work, Hunter College. This is a series of conversations designed to inspire wellness in helping professionals. Our conversations will focus on understanding the importance of self-care, reducing trauma, and bringing to listeners new ideas and practices that promote wellness at work and in your professional life. Welcome to our show today.
Welcome back to Wellness at Work. Stacey Plichta and I have been having ongoing conversations, Stacey, about wellness at work. And Stacey, welcome back.
Oh, no, thank you. Very glad to be here. It's interesting.
Yes. Well, this is an interesting point in the work that we've done together about how you have been a leader in terms of the wellness at work, particularly for the people who are engaged in the work of adult protective services on the front line. So I'm really enjoying our conversations.
Yeah, same here. And I think it's important to think about the bigger picture as well as we go through all of this.
Well, that's a great lead in to what in your mind, and let's talk about what we think are the forces that promote stress and burnout in these systems of human services.
Well, I think the single biggest one from everything we've studied is simply workload.
Mm-hmm.
That, it can feel like a tsunami of clients coming at the APS professionals, and many of them have more cases than they really should from what would be a reasonable ratio. And, the supervisors are also overworked. And I think part of it is simply volume.
I think there's also, to add to that, there's other forces that are outside of the control of these systems, that there's institutional and societal forces that suggest that so much of the preponderance of the work that they do is sort of disproportionately laid at their feet, and they have to do a lot with finite resources and finite collaborations. And I think that also contributes to the stress and the burnout of having to sort of figure out and navigate your way through these kinds of situations to be able to get services and to be able to get optimal results for the people that they serve.
No, absolutely. Because the second thing that we hear is that folks, APS professionals really struggle when they can't get people the help they need. And that is the thing that's hardest for them. And that's a systems issue because the system really isn't supporting the workers within it. It's not supporting them in terms of giving them the resources to simply do their job. We hear that a lot. And it's not supporting them because I don't think wellness of the APS professional was ever built into the system. The people who work in this field are expected to simply suck it up, to carry on, to shoulder the burden. And the system doesn't have anything naturally built in to support them, to support their own wellness. And that doesn't mean that individual supervisors and individual directors aren't doing great work. There are some places where really the supervisors and the directors have taken this by the horns, but it's not universal. It's not built into the bigger system, and that support is certainly not everywhere.
The concept of wellness in this work, if you stood back or came from a different planet, you would think is critical, because they're very often going into situations which are either physically stressful and toxic, quite frankly, or psychologically in that way. And it's interesting how I remember when we first started talking about this, you did a lit search, and you came back to me and said there was there was very little about the work of adult protective services. There is certainly some work, I think, correct me if I'm wrong, about the work about the wellness and the health of people who did work in child welfare and child protective services.
There's some there, even there it's lean, but
Mhm.
really it's almost non-existent for adult protective services. There's some more work on social workers in general. There's even more on therapeutic professionals, so psychologists, like, mental health workers, which is a different, there's some overlap, but it's a different job. Typically, a psychologist or a mental health worker isn't coming into somebody's home and being confronted with the physicality, with the hoarding and the garbage, and
Mhm.
folks
Mhm.
who can't physically take care of themselves anymore. They're not confronted with that whole layer of risk. And there's more, the most actually in the literature is about nurses. And again, there's overlap, but protective services is a very unique profession in that folks are going into the homes of people who are hurting. And much like a emergency medical technician, an EMT, are confronting the rawest of the situation as compared to, as an analogy, emergency rooms are hectic, but by the time a doctor sees a patient, the folks in the EMT have done a lot of work to stabilize them and to clean them up. They're not confronting the patient at the scene, whereas the adult protective services professional is, and that adds a layer of stress, and when folks are stressed out all the time, they start to burn out, they start to lose their compassion. We've talked about this a little before.
Mhm. I like the idea when you talked about this as a profession, and it's kind of an interesting point in our conversation because um, I don't know of anybody who said when they were very young, I want to be an adult protective services worker, staff member, or provider. And so there's no academic track for adult protective. There's obviously more broadly social work school and public health. Um, but as our society has grown more complex, I think that the work of adult protective services has to really be considered to be a profession and not something that one can sort of undertake easily and grasp its significance without really having spent time in its.
Yeah. And I think that's something, there's low-hanging fruit, right, that
Mm,
systems can easily do, and there are things that are harder for systems to do, especially governmental systems, including adult protective services, move slowly. They just do. It's the nature of bureaucracy. It creates stability, but also makes it hard to change. But one thing the system can do is to really start regarding adult protective services workers as professionals and to stop using the word worker. And we'd heard that at the conference we were both at, and that really
yeah.
struck me as being important because these are folks who are professionals, who have a high degree of training, who may come into this with a bachelor's in math. They may not come into it with a background, with the initial academic training, but they are immediately and continuously provided with the training to help people who are in crisis, to help elders and other vulnerable adults who are in terrible situations. And much of what they have to do initially is use their own judgment.
Mm,
We think of a worker, we think of somebody who is acting under a fair amount of supervision and rigid rules. And that's not really true. The adult protective services professionals, when they go in, of course, they have policies and procedures, but they have to decide on that spot and moving forward, what are they going to do and how are they going to handle this? And it really, a lot of it's at their discretion.
right. So let's talk a little bit about what does burnout of a stressed person look like?
So somebody who's burnt out is, first of all, tired. They're weary. Um, they can appear apathetic. They can appear low energy. They can be short-tempered, cranky. They can have run out of ideas. So when somebody's burnt out, I think one of the biggest risks in adult protective services is there's this need for creativity. There's this need to problem solve on the spot. And when folks are burned out, they don't have that ability necessarily to think quickly, to come up with ideas that are out of the box. They're barely making it through their day, just doing what they have to do. And they don't have a lot of extra to put in. And this is a profession that needs that extra. And so I think it's important for the workplace to be able to first recognize burnout. Well, recognize it when it happens, ideally prevent it before it happens, but provide support to the professionals that work there so that it doesn't interfere with their job and functioning, and also so that they can have, so that the professionals can have a quality of life. We spend most of our time at work, and that really gives the workplace an obligation, I think, to support the workers.
I would agree with that. I think there's also the interesting straddling that people who are in this work both have to navigate systems of complex bureaucratic systems, but also have to navigate complex people when they encounter them in their work. And I like what you were talking about, the creativity that becomes necessary for both kinds of navigation. So when you're trying to figure out your way to get to a service and there's no clear pathway, that's when your creativity becomes key. And what you're saying is that in stress and burnout, the creativity is diminished or almost flattened. Yeah. And you're sort of clinging to I guess what I would describe as most comfortable or what's easiest, because anything else seems to be disproportional.
Yeah, insurmountable. I mean,
yes,
that's been,
yeah.
And I think what you said is really important, that the creativity isn't just in the work. The creativity is in the work, but it's also in the relationships with others. And folks who are burnt out, it's harder to maintain good relationships when you're exhausted and short-tempered and don't really want to deal with other people. But that's the whole job, is in one form or another, the whole job is relationships.
And so we can go on, and Stacey, I probably can talk about this for hours. But what I also heard what you were just talking about is the sense of, when you're stressed, the being faced with otherness, other people, other cultures, other kinds of people who are not familiar, that would you say that can also be stress, can also compound stress when you're already stressed?
Yeah, I'd like to back up for a second. And it's not stress itself that's a problem, as we've talked about. In the short term, we need stress. We need stress to help us act faster, move quicker when necessary. It's the chronic stress. It's when the stress is never relieved, when the stress never goes away. What I like to say about adult protective services work is the stress is the job. And the important thing is to help the professionals to manage the stressors and to know how to turn the stress response off. Because when you can't turn it off, it leads to lots of things, including burnout. And then, yes, anything that's different, anything that's other than what you're used to, is harder to deal with, because dealing with something new takes energy. And the hallmark of burnout is simply a lack of energy. That's something that systems from at the level of the individual agency on up to the organization at the state level can really address, but most don't.
So, Stacey, I'd like to sort of steer us towards the thing that we've been talking about, which is the burden of multiple truths. Um, there's the burden of multiple truths both before, during, and after you've engaged with a client and or with a person who is at risk, and you're trying to figure out what's the best path forward to get the optimal kinds of outcomes that are necessary to get this person to be safe and remove the risks. Let's start with the burden of multiple truths at the beginning when you're first encountering a client or even before that. Does that make sense?
Absolutely. And I think for our listeners, very quickly, the burden of multiple truths is that many things can be true at once.
Mhm,
So, an APS professional can do everything right,
mhm.
can interact with the client, can build that rapport and that therapeutic alliance, if you will, can get them all the services that they need, can connect them, and the client can still do poorly. The client can still pass away. The client can still get hurt because so many things are out of the control of what an APS professional does. And so, plus a lot of the folks who are getting help, they're maybe medically frail simply because they're older or because they're an adult with disabilities that is at higher risk to begin with. So the truth of you can do everything right and the person can still do poorly or even pass away can be really hard because that feels like failure. And the other thing that contributes to burnout, one of them is workload. The antidote for burnout is success and being able to feel success because success is energizing, right? Burnout is exhaustion, so success is energizing. But when a client does poorly, it feels like failure. And that becomes a problem because not all APS professionals themselves and not all supervisors tell the people that work under them that, hey, you did everything right. This is not your fault.
So this is interesting. So what I hear from the low-hanging fruit for me is the definition of success is critical in terms of
Absolutely.
understanding. And context is another, within the context of each case, with each person that you're encountering, rather than trying to find a more global, if you will, sense of success. Does is that does that ring home for you?
Absolutely. Because how we define success is how we feel it. And that is something that supervisors and team leaders, and all the way up the line in leadership through, deputy commissioners in the city and, directors elsewhere can really do is to make it clear that success is process as well as outcome. So in health services research, we talk about two different kinds of measuring did something work. One is the process, right? Was everything done the way it was supposed to be done? And the other is the outcome. Was the desired outcome achieved? And you can have a perfect process and still not get the outcome that you
Mm.
want. And I think being able to show the people on the ground, being able to help them feel the success of, hey, you got this person food delivery, you got this person a deep cleaning, you got this person connected socially to someone they weren't before, or you got this person, let's say even, and knowing where the client is starting is where you should be defining success from, not this big, huge endpoint. If somebody has been living in a hoarding situation for years, they're not going to have an immaculate apartment the next week. It doesn't work like that. If the person agrees to throw out one bag of trash, or even, that's success. And I think it's important to have goals along the way to what we think of as the ultimate success and to acknowledge those. And that's from both within the individual APS professional and it needs to come from outside. their supervisors need to be showing them their successes as they go along.
So we're equating or connecting success and wellness.
Yes, very much
And so, with the idea of sort of keeping your team healthy,
so. Mhm.
distinct from happy, how would you weigh in on that?
Well, that healthy and happy are related, but they're not the same, and that sometimes it's healthy to be sad. For example, when a client passes away, probably not a happy moment for the team, but allowing the, the people that work directly with the person to grieve, allowing the entire office, if this was in smaller APS systems, sometimes the entire office knows the client. Allowing them to grieve, working through the sense of sadness and loss is healthy. It's not a happy moment, but you need to be healthy before you can be truly happy, as a team. So, it's more than the Atta girls, if you will. Those are important, but it's more than just that. It's more than that feeling of happy in the moment. Keeping your team healthy means keeping them functional and addressing the negative things head on as well as the positive things, while doing everything you can to help keep them resilient.
So teams and team leaders,
Mhm.
both, I think team leaders, this is wellness should become much more central to their role um, in providing and keeping um, a healthy team, as well as the possibility of creating a sense of happiness on their team.
No, and there absolutely should be moments of happiness. There should be,
Mm.
there should be
Celebration.
celebrations. And I think more than happiness, there should be generally feeling a sense, if a team has a sense of competence that they're doing their job well and they feel good about it, that really is one of the goals. And, it's important for several reasons. First is the very human reason that, people working in this field are people. We spend most of our time at work, and we want the people doing work with other human beings to be happy, to feel good about their work, to be engaged with their work, and to care. But also from the perspective of wanting to get the work done from a much more, I guess, practical, if you will, perspective, or a what's in it for me from the workplace perspective. You know, people who, workers who are engaged in the work, who are feeling success of the work, who are happy, who are healthy, who are well, are simply going to do a better job than folks who are burnt out and have
Mm.
compassion fatigue and are starting to really feel the health effects of always being stressed with no relief.
So let's talk a little bit about some practical, hands-on ideas about what that looks like. I think you've touched on a few of them. What would be some others that you can think of that can contribute to the wellness of a team?
So ultimately, I'm going to take it from the big picture on down. Ultimately,
Sure.
I think every team needs a wellness plan that's an explicit plan for their team. Every APS agency needs a wellness plan that's built into their strategic plan, because we don't organizations do not take things seriously unless they're built into the strategic plan, unless they're built into the mission, unless they're considered a core part of functioning. So starting from the top, wellness needs to be in the strategic plan. And beyond that, there needs to be a specific plan for each team. What does wellness look like? And this is, what does supporting the professionals who do the work look like? And this is going to be a little different. But some things that can be common are, first acknowledging that folks have lives outside of work, and those lives also can bring stress, can bring challenges. And what does that look like? That looks like not calling somebody after work hours unless it's a true emergency. That looks like not emailing people after work hours. Most emails now have the function where you can write the email at 3 in the morning, but you can set it so the other person gets it at 9 a.m. But if you're writing email at 3 in the morning, you should be thinking about your own wellness as well and why you're doing this. You know? But no, but still, like people organize their work in ways that make sense to them. So, make the one of the things I hear a lot. I heard this a lot during COVID, but after as well, from folks who are doing resource navigator work. The supervisors were complaining that they could not get the folks under them to take their breaks. They couldn't get people to take that 15 minutes where you get to walk away from the computer. They couldn't get them to take their lunch. So one thing a team leader could do immediately is really insist that people walk away from their computer for lunch. That's half an hour that's yours. Go read a book, go take a walk, go sit in your car, go eat in the lunchroom. Do something that's not work because you will be better for it when you come back. Another thing that's I think really important is acknowledgement. And it's not by itself, it's not everything, but when someone does a good job, helping them see their success, that 2-line email or that quick text of, hey, great job with that client, and acknowledging things along the way, not just the end result. Hey, really good job getting them hooked up with a deep cleaning. Really good job finding that relative that nobody knew existed, sort of those acknowledgments. And also building it up in a way that the successes are acknowledged to the whole team. But it needs to be consistent. Like I really like the idea. Well, actually, I'm mixed about like the whole, worker of the month or professional of the month, if you will. Um, as long as it's evenly spread out in a sense that people are acknowledged for the different things they do well. But it has to be consistent. There's nothing sadder than going into an agency and seeing a poster for Worker of the Month from like 10 years ago, still pinned to the board because nobody came up with the next one.
I've been there. It looks like it's almost like a picture in the post office versus person now. So I also hear like the idea of the team wellness plan, but it should be replicable from the agency and the agency's wellness plan. It should be reflected in the team wellness plan. So how about if we talk a little bit about team building within the concept of wellness? Stacey, now if we could, let's talk about team building around wellness. And I think, in conversations that we've had, the critical point of change is obviously COVID. So team building around wellness before COVID, and then team building around after COVID. What does that look like?
Well, COVID was a disruptor. It was, a historic disruptor. We hadn't had a pandemic in 100 years.
Right.
And so prior to COVID, pretty much everybody was in the office together, and so there was a lot of the informal interactions are part of what cement a team. There are formal things that can be done, and we should, we'll talk about those. There are certainly specific actions that, leaders at every level can take. But ultimately, there was much more interpersonal interaction, so it was easier to plan group events. And then COVID comes and we're all sent home. And we're all doing things. Our work has now invaded our home space. And most people were not set up for that. So, it wasn't like they had an office where they could shut the door. They're now working in their bedroom or their kitchen, the place where, they sleep and eat, and, which is their break from work.
Mhm.
And then there's not nearly as much connection. So how do you, part of a sense of team is a sense of being in this all together. And I think COVID did give us that. But the being in the work all together is much harder when you're not together. Yeah.
Right.
And a lot of the team building that we're starting to come back to, or we can come back to now pre-COVID, wasn't available during COVID. Like, we're beyond being workers or professionals, we're also simply human. Humans have a need for face-to-face contact. We bond, every culture ever bonds over food, right? Over eating together. It's hard to have a potluck or a group lunch when everybody is home in their own corner. We bond over common experiences, over helping each other. And so while those things certainly happened during COVID, they happened through the lens of Zoom, if you will. I think most folks were using Zoom, but they happened through the lens of a camera rather than in 3 dimensions. And they happened in 2 dimensions. So you got 2 dimensional levels of team building.
Oh, wow. So, yeah, having led a team before and after, I had to say I struggled with it at first because those sort of, I, for example, um, why don't we all go out to celebrate a particular success? Became almost logistically impossible because
Yeah.
some of us we weren't all existing in the same biosphere, if you will, or the same neighborhood. Um, and there are other things about what you were talking about, the 2 dimensions, that I always think was very interesting. Is that sort of thing about, everybody talks about Zoom face, where but I couldn't get a sense about how people were doing, and there was no playbook, quite frankly, about remote supervision.
Yeah.
And so that I know you have something to say about that.
Yeah, I do. I think, there was no playbook. Again, this was a historic cataclysmic event, right? That nobody was prepared for. And yet there was remote work beforehand, but it was never centered. And it certainly wasn't centered in human services at all. Um,
Yep.
and so people like yourself and other people who are building teams, really struggled. We struggled in academia. We like to build that sense of togetherness in our students. We would used to have, we're getting back to it now, like 2 like potluck meals a year. We did a PhD student dinner where we sent everybody a gift card and then had them order their dinner, and then we were all together on Zoom. And it was certainly much better than nothing, but it's not the same.
Right.
And
Right.
so I think that being in person, and as people are coming back to the office in a more balanced way, because there was also some real advantages to working from home, including all the disadvantages. You didn't have the commute time. If
Mhm.
there was something in your personal life you needed to handle, you had more control over how you moved your time around generally. And so, even something like making dinner, you could put a pot of soup on in the morning, but you're home to watch it, you know,
Mhm.
as opposed to
Mhm.
leaving it there all day. But I think
So, sorry, go ahead.
now that we're moving back to at least partially in person, and I think remote work for a day or 2 a week is a good idea because there's another thing that helps with burnout, and that's people having control over their time. Um, but for teams to start doing those team building activities, and that's going to look different depending on the culture of your organization, of your team, of your area. That could look like a potluck. I know one team, their bonding activity was they picked a really trashy Netflix show. I don't know which one. I remember, and it was like one of those shows that had like 20-minute episodes. And every
Yes.
Friday they would watch this trashy show together and talk about it.
That's very
And,
funny.
it gave them something to talk about together that wasn't about work and wasn't personal. So it didn't require a whole lot of disclosure to get people interacting. And the other thing I just wanted to mention is that our social skills all got kind of rusty in the
Yeah.
past couple of years. We're realistically a year and a half out of the strict isolation. COVID's still with us, by the way. And here's my plug: please get vaccinated. The vaccinations are out in many states. You don't need this prescription, but it's like many diseases, it's come to be something that's cyclical, like the flu that we're just used to dealing with and being able to go on with our lives. So um, we're just really coming back into the social sphere, and I think that's going to take a little bit of intentional effort on the part of leaders to get their teams rebuilt so that they're socially meshed.
So this is a good point. What else do you think leaders can do to accentuate the idea of wellness at work?
They can, well, first, they can model it, they can make it a priority. And again, like when I said, put it in the strategic plan, put it in the vision. Part of the vision should be, whatever you do, do it with professionals who are healthy and well themselves, you know,
Mhm.
and then acknowledge it. So from the very top, if there's a supervisor doing a really good job with their team, that's something the director should commend them for. People do the things that get noticed, commend them for it, put it in their review, if it's a positive, make it really clear that it's an agency priority. So starting from the top then and modeling it,
Mhm. So
modeling separating work and home, for example.
making it substantive as opposed to performative.
Yeah, making it substantive, and then making it clear it's important and that this is something the organization wants. Most APS agencies, because they're governmental, are going to have access to things like EAP, Employee Assistance Programs, which means that every single person who works there has access to some kind of therapist, by phone for free for a certain number of sessions. They have access to other things. Make those resources explicit, encourage people to use them. Again, these are lower hanging fruit. It doesn't require any new investment. It simply requires a readjustment of priorities and maybe a focus on those priorities.
Well, so with the time we have left, if you could talk a little bit about how compassion fits into this, it'd be interesting, I think, for people who are listening.
Yeah. So compassion is related to empathy. Compassion means like feeling suffering together, right? Or feeling with the other, and taking action. And so I think compassion is one of these primal human motivators. And there's a lot of research that shows that altruism is hardwired into us and that
Mm,
we are compassionate and we respond to compassion, but we also need compassion for ourselves. So I think the idea of having compassion, not just for the clients, and that's certainly important, but having compassion for the APS professionals who are on the front line or who are in the office supporting those in the front line, having compassion for the staff, having compassion for ourselves is important
mm,
because that compassion is so important to the practice of
mm.
good, effective adult protective services work. And it's hard to feel compassion if you're burned out. And it's hard to feel compassion if you're not supported. And it's hard to feel compassion if you don't ever feel like you're a success. And those are all things that the workplace can work on to make better.
Thank you. Are there any sort of practices or exercises you want to take us to sort of end this particular episode?
I think talking to the folks who are doing the work and the ones supporting them in the office, so the non-supervisory staff, and really finding out, like, have have a talk session or do it via suggestion box. Again, every culture is different.
Hmm.
But step one is to find out how are they feeling right now? Are they getting what they need? What do they need? And some things that people are going to say they need, like there's not going to be big raises coming, right? There's not going to be more money coming. There's not going to be more vacation time coming. Those aren't realistic. But what is it that their supervisor can do, that their director can do, that what is it that the leadership can do to support them? What is it that they need? And simply finding that out can go a long way. Asking the question and opening the door in and of itself is therapeutic and helpful.
Finding attainable practices that promote wellness at work.
That are relevant, attainable practices. You're only going to know if you're relevant if you talk to the people that you're designing these practices for.
Thank you.